Thanks for joining me this morning. My name is Doris from the Wilburn branch. As you all know, we are living in dangerous times with COVID-19 still having a firm grip in our lives. Now, more than ever, we need accurate, current health information. What I'm going to be talking to you about today is how you find that information. I will talk to you about three things: the ABCs of evaluating a health information website. Then I will cover Medlineplus, a trusted health information website. And then I will go over some local and federal websites with information about coronavirus. What's the first thing most of us do when we go to try to find health information? We probably Google it. Do we automatically get the most accurate, unbiased, and current information this way? Not hardly. What's the best way to critique the websites that do come up? Do we just pick the first one? I'm going to show you a better way. The ABCs of evaluation. First, you look at the authority and accuracy of the website. Who sponsors the website? The URL is going to give you a tip as to this. A .gov site is sponsored by the government. A .com site is sponsored by a business. A gov site or an edu site is going to give you researched information, more likely accurate. A .com site is usually trying to sell something. A also stands for accuracy. It's a website free of errors and based on sound medical research. B is for bias. You see bias in the website? Biased websites will often appeal to the emotion, using words such as miracle cure. A less obvious example is a drug company. There will be a lot of accurate information about the disease, but only one possible cure, the drug. C is for convenience and currency. Current is another word for usability. Is the website easy to use for the non-medical community? As to currency, is it regularly updated? Now I will talk about Medlineplus, a website that has accurate, unbiased, updated, and consumer-friendly information. This website is sponsored by the National Institute of Health, but it is good for the consumer as well. When you get to their homepage, you will see a search bar at the top which searches all portions of the site. You can also browse health topics, get information about drugs and supplements, and information on medical tests. Find that the search box is the best place to go if you know what to look for. For example, if I put in acid reflux, I get a set of results that are all legitimate websites of the medical community. I can limit on the left the type of information I want to display. For a search of a drug, I put in Plaquenil in the search bar. That's been talked about a lot on the news lately. I see the generic name there. You all will probably recognize it, and it returns the generic name for the drug. Of note, you can get accurate information on herbal supplements as well. I think you will find that Medlineplus is easy to use and worth an extra step from just Googling and taking the first thing that comes up. Now let's talk about how to get current information on COVID-19. The news changes every day, so we are looking for the most current information. I will highlight federal and then local resources. First of all, the CDC. When you click on coronavirus, you see how to protect yourself, what to do when you're sick, and what you should do if you get tested. And it talks about the different types of tests that you can get and what they detect. By scrolling down, you can click on cases in the US, and that gives you the total number. You can also go to a state and see their official source for their statistics. So I'm going to go to another state as well. So there's their page where they report their statistics. There's also cases by county that you can go to each state, but it sometimes doesn't have the most current information. The next source is ready.gov. If you click on Learn COVID Facts, it's going to take you to a website that is a combination of the White House and the CDC and FEMA. You could see the different symptoms, the guidelines for the different areas, and FEMA's response to COVID-19. And it gives you resources for other disasters and emergencies as well. The Department of Public Health's website has state-specific information on COVID-19, including testing sites and numbers to call to register for a test, steps to protect yourself, and what to do if exposed, and the COVID-19 helpline. It's also the place to go for statistics on COVID-19. At the top, you see just the boiled down total statistics. You could see the date it was updated. It's usually updated once a day. It gives how many tests have been conducted. If you go down, you see the chart. If it's solid, then those are confirmed cases. The light colored marks are cases that are still not confirmed yet. Cumulative cases will give you the total number of cases, so you can see the way it went up. There's also information about deaths that work the same way. You can go to cases by county. You can go to the map, click on the county, and then you'll see the same chart, but it is just information for that county. So I'm showing you Gwinnett County there. Our cases are going up. The deaths are going down. There is Georgia Emergency Management website. It will give you the instructions for the different reopening for the different types of business. There's also a situation report. This gives statistics that you don't really see anywhere else, such as an increase by county, and also some information about how the hospitals are doing, how many beds they have in use per region. The last site I'll talk about is the Gwinnett County Health Department. On that site, you can make an appointment online. You can also get quick information about things that you can do for your health. And there's also a report by zip code map. There are statistics boiled down to the different groups of people, elderly, ethnic groups, and such. This morning, I've gone over how to find accurate health information websites and given you several federal and local websites specific to information on COVID-19. Let us seek accurate information, and this way we can guard the health of those around us.